Hello friends, welcome you in Research Needs. In this video, we will see commonly used blood withdrawal techniques in laboratory animals using Ex-Pharm software. So we will go inside. Here you can see our software is ready to start. So we will click here to visual practice and it will show you here to start practicing. So we will click here. So here you can see it is showing two tabs, first theory and second is practice. So we will go first to see theory part. Here you can see commonly used blood withdrawal techniques in rats and mice. So we will see here and we will read it speedily so that you can easily understand those things. So here blood collection is very common requirement for experimental pharmacology procedure. The method of blood withdrawal in mice and rat is dependent upon the volume of blood needed and the frequency of the sampling. So what happened, many times you need large amount of blood. So that time what procedure we have to adapt, we will see from the followings. The most common used blood withdrawal method in rodents are retro-orbital sinus blood withdrawal methods. So it is mostly used blood withdrawal method. Generally it is very easy and convenient method. So next is tail snip blood withdrawal method. It is rarely used. So tail blood withdrawal from tail, intracardiac blood withdrawal, posterior vena cava blood withdrawal, sinus sampling, medial or lateral approach, submandibular sampling, jugular vein sampling and dorsal metatarsal vein. And next here it is showing the procedure for retro-orbital blood withdrawal. So that we will see ahead. Next we will see some methods among these with practical. Here you can see commonly used blood withdrawal techniques for rat and mice. So these method it has already established. So we will see these first. So we will go first in retro-orbital blood withdrawal method. In this we will first see the theory part. So I will speedily read this. The animals is anesthetized with a inhalation anesthetic such as isoflurane in bell jar. Once the animal is fully anesthetized, the eye is protruded by the placing a finger on top of the head and along the jawline. The capillary tube is placed in the median part of the eye at 40 to 45 angles. Apply pressure by gently rotating the hematocrit tube, and this will cut through the conjunctival membranes and the blood will flow into the hematocrit tube by capillary action. Once the blood begins to flow, maintain the pressure to keep the eye protruded. After collection complete, to stop bleeding, release the skin, allow the eye to return to the normal position. So now we will see the video. Here you can see this is capillary tube. While you inserting it into the eye, you can see the blood is moving out. So next we will see the practice. We will click the capillary tube. Click on capillary tube. So now we will collect this in append trough or in test tube. So we will see the next one. So next is tail snip blood withdrawal procedure. Theory: the animal is placed into the restrainer tube such that the tail is accessible. The tail is whipped with a slight warm water. For the tail snip, the tail is extended and the end of the tail 0.5 to 1 mm is in case of mice and up to 2 mm in case of rats is cut with the scalpel. 10 to 15 number scalpel number. The cut is made over the lateral tail vein. The tail can be stropped from rear end of tip to encourage the blood flow. The blood is collected from the tip using the hematocrit tips, or blood allowed to drip from tail directly into the collection vial. So we will see the video. Here you can see the animals is placed in the restrainer and we are directly cutting the tail part. From here you can see easily blood is collected. Next we will see the practice. Now we will click on knife. It has cut. Now we will collect the blood. The blood amount is very less by this method. So we are doing blood withdrawal by this method for generally we are cutting this tip, and from here we are taking the blood for blood glucose level. So it is very easy, or we have to pinch here to get the blood. So it will be very less amount of blood we can collect for blood glucose level determination. So it is very easy. So we are using generally this method. We will click on the capillary tube. So now you can see it is not giving that much of amount of blood. So but here it is showing practice, so we can understand these things. So we will go ahead. Tail blood withdrawal from tail. So we will see theory part. Animal is placed into the restrainer tube such that the tail is accessible. The tail is whipped with slight warm water. For the blood withdrawal, the tail is extended and the blood is collected by syringe. The tail can be stropped from the rear end of tip to encourage blood flow. The blood is collected in this syringe. So we will see the video. Here you can see. So they are directly showing this here to collecting the blood from the tail vein. But before collecting the blood, we have to do lots of work. We have to clean the tail properly by using hot water or by isopropyl alcohol. So by that we are cleaning, and sometimes to properly see the veins we are also applying xylene on this, on the tail. So it so completely it makes visible, completely visible the veins. So we will go for practice. Here you can see animal is under restrainer, and we will click on syringe. We will click again on the injection. From here it has collected the blood. We will see the next procedure. Cardiac blood collection. We will see the theory. The animal restrained by the scuff with the body hanging vertically. The needle is protruded in the notch just to the left of the animal's xiphoid. The needle shall be kept parallel to the spine and placed just under the ribs. Place the needle protruded up into the chest and puncture the heart. Apply slight pressure through the syringe. If the needle in the heart, blood will flow automatically into the syringe. Wait until the blood gets filled in the syringe before adding more pressure on the syringe. So this is the syringe measurement. Here it is given 22 to 25 gauge and 1 inch needle is needed. And for collection blood from rat, it is 10 to 12 cc syringe with 18 gauge and into 1.5 inch needle is preferred. So we will go for video. So here you can see from the cardiac blood collection. This method is generally not used in emergency condition when animals is about to die. That time we are using this method to collect large amount of blood, and we are not able to collect the blood from this retroorbital. That time we are collecting from this method, while it is 100% sure animal is going to die that time. So we will see the practice how to do this. So here you can see animal is gripped properly, and now we will click to syringe. So we are inserting in exploit process inside, and now we will click the syringe. It has collected the blood. For this type of blood collection we need lots of practice. So first time you will, if you try, you will definitely kill the animals. So don't try. You need lots of experience to collect this type of blood from the mice. Now we will see the next method. Posterior vena cava blood withdrawal. We will see the theory. Animal is placed in the surgical platform. Dissection tray, injectable anesthesia or inhalation anesthesia is applied. It is ensured that the animal is completely anesthetized as determined by the toe pinch or tail pinch. The skin is lifted and the small transfer cut is made through the skin just above the pelvis in female, or just above the prepuce in male. The muscles is lifted and the small transverse cut is made through the muscles just above the skin cut transversely along the side of the ribs on the both sides. Gently protrude the intestine to the animal's left to exposure the posterior vena cava. Insert the needle protruded upward into the vena cava midway between the joints of the renal vessels and the iliac bifurcations. Slowly withdraw the blood by applying pressure on the liver. Now we will see the video. Here you can see the animal above the pelvic area. It has transverse cut was applied. Now we have to remove the intestinal part. Then below the liver area you will find this posterior vena cava blood withdrawal. So here you will see, here it is the liver part, and below this, behind this you will find. From this method, when animals is about to die and you are not able to collect the blood from cardiac puncture also, so that time you can go by this method. But this method is generally used if animals is about to die, or it is more preferable method than the cardiac puncture. It is possible that from cardiac puncture animal is you can save the animal after cardiac puncture also, but after this method it is very difficult to save the animals. So you have to use this method only when it is decided that animal is you are going to sacrifice the animal. So that time you can use this method. Now we will practice. Here you will see we have done the cut, and then we have removed the intestinal part, and we are able to see the posterior vena cava. We will click on syringe and we will collect the blood. So now we will see the next method. The last method, it is miscellaneous. Here we have to read only. In addition to method discussion above, following methods are also used for blood withdrawal: is saphenous blood collections, medial or lateral approach. In this method, blood is collected from the saphenous vein of the leg of the rodent. So here you can see submandibular sampling. In this method, blood is collected from the submandibular vein of the dental regions. Jugular vein samplings, blood is collected from the jugular vein of the neck regions. And dorsal metatarsal vein, blood is collected from the metatarsal regions. This method is preferred for rat over mice. This was the commonly used blood withdrawal techniques in the rat and mice. How was the video? Please do your comment. Thank you for watching Research Need. Thank you very much.